I've recently seen this post make the rounds online, and let's break down the stupidity. Now, first off, this person, they are not a medical expert, nor do they know better than medical experts out there, and they're going directly against medical evidence and medical best practices. Now, setting aside for a second the absolutely unethical nature of what she's proposing, which, by the way, you should never do when it comes to medical interventions, which is why in modern times medical professionals aren't going to do this. Although, it has been done in the past, and you know what happened then? It worsened the condition. Essentially, imagine a fire going on, and then you decide to put it out by adding fuel to that fire. Her solution is like trying to put out an oil fire with water. You're not helping the problem. Secondly, it's biologically idiotic. Why? Because extra testosterone in the body gets turned into estrogen. It's why you often see when bodybuilders take supplements, a lot of them start developing breast tissue, or what's called in men gynecomastia. Because with this hormonal imbalance, that extra testosterone gets converted into estrogen. Thirdly, this kind of thinking is not remotely based in scientific evidence. There's actually no evidence of causality between someone's hormonal levels and them being trans. Your gender identity is not caused by your hormones in your body. Your gender identity is in your brain. You do not control it, neither do your hormones. Those of us who do medical transition helps us align our bodies with who we are, but hormones aren't what causes you to have the gender identity that you have. Even anecdotally, most trans women, what they do before eventually transitioning is actually trying to go more hyper-masculine before finally realizing that that was not a solution. Some people will join the military as a result. Some people will work out and take supplements thinking that being more of a man is what's going to help them, only to then figure out that it worsened the problem for them, because it's not that that's the issue. Extra testosterone isn't going to make you feel more like a man. It's just extra testosterone. Again, your hormones don't make you who you are. They can help, but it can also worsen if you're under the wrong hormone. Now, lastly, about addressing this Russian asset's point. This is just plain evil, because what she's arguing for is medical conversion therapy, which has never worked. What this person is demonstrating is the arrogance of ignorance, which is so common amongst transphobes, because they are showing that they know nothing about biology, about sex and gender, and about what it means to be trans. So takes like these belong in the garbage for the stupidity that they are, for ignoring medical evidence, for ignoring medical best practices, and for being plain evil and unethical.